Hi everyone, my name is Tom Compton. Thank you very much for the opportunity to present to you all today. Um, Today I'm going to be talking to you about a stepwise implementation of diagnostic network optimization. And I'm going to go through a few things. So firstly, I'm going to give an overview of DNO, Diagnostic Network Optimization. You'll hear that abbreviation a lot today, for those of you that haven't come across it. And then I'll go through in detail the recent stepwise guide that we've published with GLI and the Stop TB partnership. And then I'll go through a few case studies of how DNO has been implemented in countries and how the stepwise guide can be used. So firstly, what is DNO, or Diagnostic Network Optimization? So what we're really trying to do is ensure we have the right amount of testing at the right time in the right place. And as always, to make sure that at an affordable and sustainable cost. So we maximize our resources for patient outcomes. And so what we see in the current reality is that it's not always that simple. There's varying epidemiological contexts, health system context, geographical context, as well as in some places some inefficient and siloed health systems with, as many of us know, constrained resources. And we also know that in many countries, patients travel long distances and incur significant costs to access these diagnostics, and it's not always equitable. So we're really trying to solve some of these problems using optimization. And so diagnostic network optimization is usually a trade-off between three things: patient accessibility, device utilization, and cost. Obviously, we want to minimize cost always, but ensure patients have the best access while ensuring our devices are not used to overcapacity. So we're always kind of balancing these three things. Maybe we can increase patient access, but that might increase our cost. And is that trade-off worth it? And so a kind of brief high-level schematic of how we think about the diagnostic network. So we have people and patients, and they access health facilities. Some of them are close, some of them are really far, and within that, there's also laboratories. Now, laboratories can be on-site at health facilities or specific laboratories. Patients can access straight to a laboratory or to a health facility. And so this is kind of the accessibility component we think about. And then there's also the referrals. So referrals from health facilities to laboratories or on-site testing, and how that whole diagnostic network works, which is where the diagnostic network component comes in. And those two together make up diagnostic network optimization. So with that brief background on DNO, I'm going to chat about the implementation guide. And so the objectives of this stepwise approach to DNO for implementation is we want to make sure we know how to use data to improve our diagnostic networks. We understand each phase of conducting a DNO. It's done in a phased and stepwise approach. And understand what tools are available to solve these common challenges, what data is required, what do we need from our diagnostic networks, from our laboratories, from our health facilities, and make sure we enhance the impact of these analyses so that after we've put in the time to analyze all of this data, we get the best results. And so the kind of target audience for the guide is countries, ministries of health, NTP, and other programs, and really want them to understand the best practices for conducting and implementing DNO. And this can be across sectors, so it can be TB, but also other programs, HIV, HPV, whatever else it may be, as well as donors and funders, and making sure that they understand how these outputs inform their investment decisions to make sure that in our world of constrained resources, we are getting the best bang for our buck, and as well as the implementing partners to make sure they can provide structured guidance to better align with the national health objectives. So this implementing DNO analysis we've broken down into 10 steps, and I'm going to take us through these over the course of this talk. And the most important being steps 4 to 7, and we'll go through those in a lot of detail and then provide some examples. So to start with, before you start up the DNO, you want to set yourself up, and there's three main things to start off with. The first is stakeholder engagement. So you want to make sure that the Ministry of Health leadership is essential to having a successful DNO, as well as this multi-sectoral collaboration. So even if it's only for one program, you want to encourage other programs to be part of and involved in this discussion, to see what needs to be done, and make sure everyone is on board from the beginning. And then comes a situational assessment. So establish this team at the national level, and maybe include some folks from the subnational level, from different regions, different partners, and then gather any documentation. Has a DNO been done in the past? Is there anything we can build from there? What do we need to expand on? What were the recommendations from that? Have they been done? Before we go and do a whole analysis, does something exist? And use this kind of desktop review and situational assessment to understand what is the goal, what are we trying to achieve now, that the Ministry of Health wants to achieve. And then third and very important is planning. So we have to ensure the timing of these analyses is right, to make sure that once we provide these outputs, they land at the right time to inform planning for funding applications or inform policies like NSP, and make sure that we're doing it at a time where these results can be actioned. And another thing to make sure is define the feasibility. So for example, if one's going to recommend doing cross-regional or cross-border sample referrals, is that going to be possible? Is it worth doing the analysis if we know that's not even going to be possible? So make sure that some of the potential outcomes that may come from a DNO are feasible from the start. Now we're going to move into something slightly more technical, and the idea we've had here is, often when people in the past have thought about diagnostic network optimization, there's a lot of things, and maybe there's only been one complicated way to do it, and we've tried to break it down into simple steps so that you can understand what is the most suitable for your context, your country, your region. And so first we start off with the types of DNO, and we're going to go through those. What are the different types of DNO? What do they look like? And then after you've chosen that, what are the key questions that can be answered within each of those? And if I understand what I want to do, what I can answer, then I need to know, do I have the data required to analyze this? Maybe I want to answer a whole bunch of questions, but I only have data to start in the beginning, and then I would start there. And then after that, we'll look at the tools or software available to answer these different questions. So this is the kind of table which we'll expand on, but really what we want to do is start at the top of the table. So what do you want to do? And it can be one or more of these. So do we want to increase access? Do we want to integrate test types, add or relocate devices, or look at the trade-off between on-site and sample referral? And from what we've seen in the past, usually the analyses or ministries of health or implementing partners want to answer one or more of these goals. So the first thing is establish at the top here which one of these four you want to do, or one or more of them you want to do. And then down the rows on the left we've categorized these analyses into four main different types. So starting with population accessibility, this is really your simplest analysis. What percentage of my population are accessing diagnostic services? And then moving to what we call visualize and analyze. So this is really when you start bringing in capacity and utilization and understanding a kind of brief overview of the network. And then we move to more complicated things where we really start needing the computers and the tools to start optimizing for us. So if I want to integrate test types or look at on-site with sample referral, what are the optimal locations for some devices or for my referral pathways? And that also speaks to advanced optimization, and that really starts looking at costs. So remember, we had that trade-off of cost, utilization, and access. And the advanced optimization can look at all three of those. So we can look at what is the cost implications of increasing access and what does that do to my utilization. Whereas at the top in accessibility, we're just looking at the effect of access, not necessarily on cost and utilization. And so once we've established what we want to do, there's different analysis types. So accessibility, visualize and analyze, optimize, and advanced optimized. As we move down this table, it's going to require more time, it's going to require more data, and it's going to be more complex and probably cost a bit more. So those are things we need to understand and figure out what's the best solution for our context. Maybe we want to do a whole complicated analysis, but we don't have the time or the data requirements, and we might need to start off something simpler, see what those results look like, and maybe those will be suitable. So this now then expands, and within each of these, we've tried to provide a bit more recommendation or some characteristics of what these analyses might look like. And so I'm going to just focus on this pillar of increasing access. And so we'll see how, as we move down the table, we'll be able to get more analysis and outputs from increasing access. So if we're just quantifying accessibility, all we're looking at is measuring the change in population accessibility. Whereas as we add more data and move a step down, we're going to analyze the capacity and utilization across the network and then identify any gaps in access and in testing. And as we start moving to optimization, we're going to understand the impact on utilization from increased sample collection sites. So if we increase the number of sample collection sites, how does that increase our accessibility? And then in advanced optimization, we're then able to say, after we've optimized our network, what does that look like in terms of turnaround times and where are our long referral pathways? Because we've started looking at all the referral pathways. So as you move down this table, you're adding more data, you're adding more complexity, but you're also getting a lot more answers. And so the next one is we understand that type. So we understand what you want to do, and then we understand what level of analysis you want to do. And this is really to turn that into a question. So is this the question I want to solve? Now remember, we can choose one or more of these, but really what we're trying to do is find the level at which I should be analyzing. I'm not going to go through the whole table, but this is super useful and is discussed a lot in the report that can really help you understand exactly where you need to be on this table. So for example, if we're looking at integrating test types, if we start off at quantify population accessibility for integrating test types, so there it might be a country wants to integrate TB and HIV testing on all gene experts across the country and understand the increase in population accessibility. So that's what I can do at that level. Now, what I can't do is I have no idea about the capacity and the utilization across the network. So I can't measure that capacity once I integrate devices. I'll just be looking at the impact on accessibility. Now, if I was to go one step further to visualize and analyze, I then do have the capacity and the utilization, and I can understand which devices are underutilized, and they could be good candidates for testing integration. What I don't have is I don't know what the sample referrals are, what the length of those are, and I don't know what the costs are for turnaround times or for adding or relocating devices. So I think you can see that as we're going down, we're able to answer more and more questions as we change the analysis type and get more complicated. So within each of these, so assuming you've decided what you want to do and you're understanding which analysis type you think best fits, we now need to check what data is required. So we've done it in a kind of structured way so that starting off with the least amount of data and you build on that as you go. So you start off with just your laboratories and or your master facility list, so just your GPS coordinates. Where are my laboratories or my facilities on a map? And through that, I can immediately calculate population accessibility. And then we move on to visualize and analyze. And there we need some more information on the laboratories and specifically the devices. So what kind of devices do I have? Are they GeneXpert, TrueNats? What's happening in that laboratory? And also testing data. So how many tests have each of those conducted in the past year? What type of tests? And through that, I can now start calculating my capacity and my utilization. The next layer, we start adding on what we call demand. So essentially, how many tests are we expecting at each of the facilities? And if we think in the TB landscape, maybe that's the number of presumptives. So how many presumptives are coming to my health facilities, and if I was to test every one of those, what would that demand look like, and what would that look like to each of the laboratories, and do we have enough capacity? And the final one is when we start looking at referrals and costs. So how much do these different devices cost? How much are the tests for each of those devices? And what does my sample referral network look like? How can I optimize my sample referral network to make sure I save the most on my sample referral system? For example, if I'm referring all my samples within a district or within a province and not going across country boundaries, if I ignore those district boundaries, is there a lab closer that might make more sense and save me a bunch of money? Now, it should be said that as you're going through this, if you said, no, I really want to do an advanced optimization, I want to know the cost, the referrals, on-site versus referrals, everything, and you see this and you don't have all of that data, then you need to go back and say, okay, I have only the laboratory coordinates. I then need to go back and identify what I can do in the quantify population accessibility table. So this is a kind of iterative process. Let's say you've decided on what data you have, and then you can proceed to choosing a tool. So there's quite a few tools out there, and choosing the correct tool will definitely save you time and effort in your analysis. And what is really nice at the moment is we have quite a range of tools or software available, some of which are specifically designed for DNO, and most of these are either open source or open access, meaning they're free to use. So within that, we have that stepwise approach of the analysis types, so from quantify population accessibility all the way to advanced optimization. Now within that, there's different tools designed to help you at each of those things. So if you look at the first two, DXGeoMap or LabMap, those are really simple tools, require not very much data, and are quick to produce a result, but they can't do all the complicated analysis that can be done by an OptiDX, for example. So as you're going through this, you've identified your goal, your analysis type, and now you can identify what data you need and which tool to use. So by this stage, we've kind of called it a cheat sheet or a checklist. You should understand who your stakeholders are, what type of DNO you want to do. Again, you can do one or more of these, what your objectives are for the analysis, and then you start going through this process of, right, what kind of bucket am I in? Am I in quantify population accessibility, visualize and analyze, or basic optimization? What data do I have available? What tool or tools am I going to use? And it gives you some recommendations or some suggestions on how long this will likely take. So again, starting off with basic, quick and simple, not as many insights, but as you move through and add more data and do more complex analysis, it's going to take you longer, but you're going to get more insights. So that's a lot of the theory, and now we're going to highlight or demonstrate a few examples or case studies that have been done. So in Botswana, the NTP wanted to understand and assess accessibility to TB services at a national and sub-national level. So the type of DNO they were looking at was just increase access. They wanted to see how they could increase access. And for this case study, it was super fast, limited amount of data. So they did quantify population accessibility. They only had coordinates for the laboratories, and they used a tool called DXGeoMap. So through this little checklist, we understand exactly what they want to do, what tool they're going to use, what data they have, and then we can have a look at some of the results. So some of the results show us kind of for each of the districts in the country, what proportion or what percentage have access to diagnostics and what do not have access to diagnostics. So we can immediately see which districts have a very low percentage of people with access to diagnostics, but also which districts have a high population and also have a low accessibility. And so we can see, for example, the central district, there's a large population without access to diagnostics, and also a low percentage of people. And so that was using DXGeoMap, and some of the results was they were able to identify these sub-districts with current gaps, They knew where they should prioritize based on this analysis to increase accessibility, and this evidence was used to support the country's Global Fund funding request. Next case study was in Mozambique, and this is looking at expanding equitable access to TB, HIV, and other property diseases. So here they had multiple types of DNO they looked at. So they wanted to increase access, integrate test types, and potentially add or relocate devices. And the objectives were to analyze access, capacity, and the implications of test integration. And so for this one, they did a population accessibility analysis and visualize and analyze. They had information on where the laboratories were and device information. So what types of devices, how many modules, and where they were. And they used a combination of tools with LabMap and PlanWise, and took them a little bit longer than the example before. And so you can see here, they've plotted all of the devices, all of the laboratories, done an accessibility analysis, and their results showed that only 36% of the population had access to TB diagnostic services within their recommended 10-kilometer radius for the country. And so their interpretation of that was to increase from the current 175 labs to 203 by adding 28 more gene experts, and optimize these gene expert modules based on the TB testing demand, and then also add in another few gene expert modules for other tests such as COVID and viral load hepatitis, among others. And so this data-driven approach was used to inform another Global Fund funding application. So they used LabMap and PlanWise. They had data from laboratories and devices and were able to analyze the accessibility and the capacity so they could understand where they needed more and how many. Our third and last case study was in Cote d'Ivoire, and this one was a little more complicated. So here they wanted to increase access, integrate tests, as well as look at on-site sample referral. And here they want to integrate testing services to improve accessibility. And this project took a lot longer, and they collected all of the information. So they had data on where the laboratories were, what devices they had, how many devices, how many modules, where all the facilities were. They had information on how many tests could be done on the health facility demand, so how many tests were expected for TB, HIV, HPV at each health facility across the country, how the referrals work, and the costs of each of these devices. And this tool is put into a specifically designed DNO tool called OptiDX, which can solve the most complicated of optimization problems. It can look at all your different parameters and your costs and give you the cheapest and most efficient, cost-effective system for the country. And so the results we see from that after optimizing the system is our average service distance, so think about that as a proxy for turnaround time, was reduced. So that's the distance from the laboratory to the closest sample collection site. The cost of the whole network was nearly halved, and the device utilization was dramatically reduced. And so that's just by optimizing the network and after doing test integration. And so this was used to inform the NSP. There was a pilot done for the sample referral system, an integrated sample referral system, and it was used in multiple funding applications for Global Fund, UNICEF, and PEPFAR at the time. So I hope you kind of with me now that we've done the first two chunks where we've set up our DNO, we've made sure we know MOH is involved, we know what we're trying to do. And then we go into the more complicated bit of what are we trying to achieve, what question can we answer, what data do we have, and what's the right tool to use. And now we move on to actually conducting the analysis and making sure that the results we get are used by the country. And so when you're conducting the analysis, usually one would start with the baseline. So what is the current status quo? Then develop a few scenarios to compare to that, interpret those outputs, and then compare costs or compare results, as we saw in the case studies. And then, most importantly, is to implement the recommendations. So these recommendations should go into NSPs or diagnostic network optimization reports. often implemented in a phased approach, but really following up to make sure all these recommendations are used. And finally is to make sure that you've set up your M&E framework from the beginning and use it. So track your KPIs after, let's say, adding a few more devices or a few more modules. How has that changed my utilization? What does my turnaround time look like? And other metrics. So I hope that's given you a good idea of how to do a diagnostic network optimization analysis. A few common things to avoid is, again, timing. Make sure that the analysis doesn't start too late in the funding cycle. Make sure you haven't left out any key stakeholders, and that when you produce the results, they haven't been part of this process, and you then need to go and start again. Again, this idea of data, as we showed with that pyramid, if you don't have all the data available, you can still start on something and start with the data that you have available and start producing some analyses and build on that while you're collecting more data. Again, don't forget the implementation feasibility. So the recommendations that come out of this report, are they practically able to be implemented in the country? And again, especially for partners, is all the assumptions that are made in these analyses need to be verified with the country teams. Make sure you're not in a position where you've done the whole analysis, go back and present, and the assumptions that you use don't make for that country context. And again, as I mentioned, that M&E framework, set it up at the start. We've got some recommendations in the implementation guide of what to use and what metrics to use, and make sure that you've set that up from the start so you can track how it was done. So finally, just a big thanks to the GLI core group team for contributing to the report, my fine colleagues as well, to the Stop TB Partnership for funding, as well as to the Ministries of Health who provided examples for the actual guide. I'll be sharing the slides, and there's a link to the implementation guide, which is available on the Stop TB website, free of charge, and anyone can access it. Otherwise, please feel free to reach out to me. And there's also a few other useful links to a data guidance tool, which shows you where to get some of this data, links to some of the tools I mentioned, and a review of some of those tools. So thank you, everybody, and enjoy the rest of your time there. Cheers.